You're watching CTOM TV. Knowledge is power.
Hello, it's Michelle Morant here. I am a mental health professional with almost 30 years experience helping people sort out all sorts of problems. And for the last 10 years, I've been working in the field of precision oncology, personalized cancer care, and making sure cancer patients get the best possible care that medical science can provide, even if it's not yet part of standard care wherever they live. The reason that I'm here today is because I wanted to give you an update on what we know at Cancer Treatment Options and Management about cancer care right now throughout the world and about COVID-19 in general. I wanted to make sure that you had all the information that you needed to feel as confident as you possibly can in these unsettling times about what's going to happen with your cancer care and just what's happening with COVID-19 in the world, and really best practices. There's a lot of misinformation going around out there, and what I'm going to share with you today is all based on current science, some of the best sites around the world right now. We're going to visit those sites together, and I'm going to show you how to make the best use of them. And at the end of this presentation, I'll give you a downloadable PDF so that you can have those links to access and be consistently reviewing for yourself. Links like Johns Hopkins, World Health Organization, and many more. There's some wonderful resources that we're going to talk about today about how to make sure you're practicing best practices for social distancing and how to make sure you're doing your best to prevent contracting COVID-19 if you have to go out and get the essentials. We're going to share some videos. I've also got a little surprise video for you from Mythbusters talking about how germs spread, and just a short little video that you would, I'm sure, enjoy and really benefit from watching. So what I'm going to do right now is I'm just going to share my screen with you and walk you through a presentation I've prepared. And as we get to each relevant topic that I just mentioned, we'll scooch onto the internet and I'll show you how to navigate those websites so that moving forward, you'll be able to educate yourself every day on what is actually happening out there and what the best practices are, the most current information. So let me just share my screen here with you. Okay, we'll just, let's see here. Let's start a little show here for you. Okay, so first things first, we want to talk about cancer care and COVID-19, how to reduce your risk, and how this pandemic might affect access to cancer care. So what you can do to reduce your likelihood of getting COVID-19 or infecting others. So one of the main questions that cancer patients have, as of course you would, is what's going to happen to my cancer treatments? Is everything going ahead as scheduled? Based on all of the websites that I've perused in the US and in Canada particularly, and I believe the same is true from my cursory glance at the UK, Germany, and Romania, among others, cancer treatments are going ahead as planned. There are a couple of things that you do need to keep in mind though. If you've traveled recently, or you're under public health requirements to isolate for 14 days, you should not attend treatment. That goes without saying, but sometimes people need a little more reinforcement. So yes, you stay home, you reschedule your treatment under those conditions. If you don't feel well, if you've got cold or flu-like symptoms, just to be on the safe side, try to reschedule your treatment for 14 days hence. If you have a fever over 38 degrees Celsius, you should not go ahead immediately with your treatment. You should contact your oncologist's office, tell them this is a situation for you, and ask them to advise you on your next steps. All right, so we give that oncologist's office a call, ask about rescheduling your treatment. Because cancer care is essentially going forth as usual, it is an essential service, there should not be a great delay in rescheduling you. Getting COVID-19 testing is a really great idea. We'll tell you more about how you can do that in a few minutes, okay? Cancer agencies are suggesting that if it's your very first appointment with your oncologist that you're attending in the next few weeks or months while this pandemic is going on, you are welcome to bring one person with you for your very first appointment. This is because they appreciate it's a lot of information that you're going to be taking in, and you might not get it all. You can also just ask to record the conversation, but it is nice to have someone there with you for the first time. For any follow-up appointments or to receive treatments, the data that I've been seeing on the health sites for the US and Canada is that you must attend alone. So if you're normally accustomed to bringing someone with you to sit with you while you have the intravenous administration of treatment or receive your treatment, in this case right now with the pandemic, you'll need to go alone. You can probably be on the phone with that person for moral support, but you'll need to be on your own. That makes good sense, I think. A lot of people are asking about prescriptions. Should I order ahead? Should I stock up? As far as we know right now, you will easily be able to refill your prescriptions without having to revisit your doctor. So that's great. Saves the doctor and yourself from having to engage, saves you from having to go to the doctor's office and potentially be infected. Your pharmacist is authorized by the government to reproduce your prescription. So you should have no problems there. Any concerns, call the pharmacist first so that you can not bother your doctor unless you absolutely have to. Because as you can imagine, doctors are running on full thrusters right now, and as few calls as they get, the better. I wanted also to let you know that Cancer Treatment Options and Management is going to be providing COVID-19 testing to our patients, our friends and family of patients. And you can visit the link here, which is also available in that PDF. That will be available to you after this presentation. But you can visit that link and you can just fill out an order form, and test kits will be available in shipping as of Wednesday, April 1st. So we'll get those out to you. It's about a 5-day turnaround from the day you order the test to the day you'll have your results, assuming FedEx continues to ship as they are. And thankfully, they are still pretty much running on schedule. So do pre-order if you'd like this test. We do expect high demand, as you can imagine. It's very difficult for governments to keep up with demand, and so these private tests are going to be more and more popular. I also wanted to let you know that Cancer Treatment Options and Management is operating business as usual, essentially, because we are a virtual service. All of our researchers and teammates essentially work from various places around the world, largely from home offices, and so they're able to conduct their research for you. As mentioned earlier, FedEx is still shipping. Our nursing service that comes to your home and draws blood for genetic testing, such as inherited mutations and liquid biopsies, is still functioning. They are about 3 days behind usual, so it might take a week to get an appointment, but that's still happening. The genetic testing facilities are operating because, as mentioned earlier, these are considered essential services. So there's no barrier to you continuing forth with precision oncology, making sure you get the most thorough diagnosis and the best cancer treatment, even while this is going on, which is very reassuring, I imagine, and I'm glad to be able to tell you that. I also want to reassure you, something that Alex, our co-founder and chief research scientist, always tells people really is you make sure you get your flu shots. It doesn't matter that this flu shot that they made for this year isn't a COVID-19 shot. What matters is that if you start to get the flu that you could have avoided by getting your flu shot and you're infected with COVID, that's a co-infection. And most of the people who are dying from COVID-19 are doing so because they have other chronic illnesses, or they already had an infection like a flu or a pneumonia when they got COVID-19. So you can avoid that. Take good precautions, which we'll talk about in a minute, for social distancing and being safe out there in the world. But getting your flu shot would be helpful. The Prevnar 13 and Pneumovax 23 vaccinations, those are two vaccinations that work specifically to do with pneumococcal pneumonia type viruses, which again are fairly common and can greatly affect what happens should you be infected with COVID-19. HPV and shingles aren't directly associated with COVID-19, but they're always on our list of vaccines to get as soon as you can and as appropriate for you. I think shingles is specific to 50 and over. But these are vaccines that, again, they just really help to keep your immune system burden down and make sure that co-infection won't be a problem for you. We want you to get ahead of the curve here, and we're going to talk a bit about social distancing, things you can do when you go out, avoiding contracting COVID-19. But it is important that you, as a cancer patient, understand that what's happening right now with this pandemic will not prevent your access to precision oncology services. It won't prevent your oncologist from providing you with the cancer treatment that you need. Now I want to give you a general update on COVID-19, and then we're going to talk about some of those websites and have a look at them. Oh, the good news. As of today, the Washington Post released an article. It's, as I've got here, it's behind a paywall. Otherwise, I'd link it for you and show you in our chat today. But you can Google Washington Post COVID update if you want, and I'm sure the article is available elsewhere. What they say in their own language is this: the coronavirus is not mutating significantly as it circulates through the human population. According to scientists who are closely studying the novel pathogen's genetic code. This relative stability suggests that the virus is less likely to become more dangerous as it spreads and represents encouraging news for researchers hoping to create a long-lasting vaccine. So really what this means is that it's not mutating very rapidly, and very likely we will be able to develop one vaccine that can target all of us. And that's really exciting news, I think, for us all. It means that some of those timelines that have been talked about of perhaps 18 months of us having to be very concerned about contracting or passing along this virus almost certainly will be reduced, and that's a relief for sure. So, general update. Some of what I'm about to share, pardon me, will be common knowledge to you already because it's everywhere, but it doesn't hurt to hear it again. So how can you avoid getting COVID-19? Basics: wash your face and hands regularly. If you're on Facebook, there's lots of Facebook posts going around with different songs and 20-second clips that you can sing. Come On Eileen is one. And the reason for that is because 20 seconds of good hand washing with lots of soap seems to be the minimum amount of time required to get rid of the bulk of the germs. If you're going to sneeze or cough and you're not sure if you might be exposed to COVID, make sure you cough into your elbow or into a tissue, not into your hands, and practice good social distancing. This particular image here I thought was kind of cute, and it does give us a fun little image to keep in mind when we're out. Lots of stores are doing an excellent job of keeping people apart by putting marks on the floor at checkouts, or they're only letting one person into the store at a time. And certainly that's happening where I live in British Columbia in certain places. But this, if that isn't happening, is your own way of telling. Because we've all got llamas, right? We all know exactly how big a llama is. And of course, they're about 6 feet of distance from head to tail. So when you're out in public, just imagine that there's a llama between you and the other person, and don't get any closer. And of course, keep your eyes on things that the people around you are touching, and try to avoid touching them unless you absolutely need to. So we want to keep that distance. Hang on a second here. There we go. Social distancing really means reducing close contact between people, and it's used to help slow the spread of infectious disease like COVID-19. And of course, the value of this is that it's twofold, really. You yourself are less likely to get sick, but even if you're in that bracket that is less likely to die from COVID, what we're seeing from self-report actually is there's a lot of people, while many people are asymptomatic, there are a lot of people who would otherwise be deemed to be in that category of quite healthy and not likely to die from COVID, who are getting quite ill with this virus. It's not a pleasant experience, as well as, of course, some of those people, unfortunately, are dying for the lack of proper medical care. And of course, then they have greater likelihood of passing it on to others. The other thing to keep in mind in terms of giving our medical system more resources is that while the medical system gets overloaded from all these people getting a very deadly form of a flu right now, it means that there's less services available for all the stuff that would normally be happening. The heart attacks, the strokes, the broken bones, the head injuries, car accidents, all of those things, the medical system is very taxed. And so the things that it would tackle for you with quite a lot of ease aren't necessarily available now. So you want to take less risks. Don't go bungee jumping, anything that might cause you harm. Maybe skip that for this next little while so that you don't increase your risk of needing medical care at a time when it's harder to access. Things like playgrounds, house parties, bars, museums, malls, public services, church services, theaters, all of these things. In many countries, there are rules right now in place to prevent these events from happening. But in certain countries, some of these things are still allowed to occur, and you're going to need to self-select out of them so that you don't put yourself at risk or your family members at risk. Grocery stores, takeout food, picking up medication, receiving or making deliveries, getting gas. These are all things we're going to talk about in more detail in just a few minutes. But these are on the list of things that you're almost certainly going to have to do or have someone that you care about doing for you. And there definitely are some best practices, but we really want to be careful as we're doing each of these things to practice good social distancing and good sterile technique, which we'll talk about in just a minute. There's all sorts of stuff you can do at home, and thanks to the advent of the internet, of course, no doubt you've already discovered some new TV shows of interest to you, some new documentaries, some fun games. Maybe you've even discovered that you can play games with your friends online. For the kind of 30 and under crowd, this is just a given. They've been doing this forever. For any of us 30 and over, this might be a new concept. But there's some wonderful online services that are set up for the purpose of allowing people to play games together. You can simply Google game playing with friends online, and you'll find a whole bunch of different options that actually have the games embedded in the programs, or where they just provide audio and video interaction and you just share the game together. My son and I played Dungeons and Dragons with his best friend for his birthday this last weekend because, of course, we couldn't be together. So his family and our family spent almost 3 hours together online playing Dungeons and Dragons. It was a lot of fun, and it worked out really well. So that's something that you can do. Walks or hikes. Remember keeping that llama distance. Ideally, if you're going to go for a walk or a hike, it's in an area that isn't very populated, but do keep that distance. If you have a dog, try to keep your dog on a leash if you're going to be in public areas. The idea is that we don't want other people to touch our doggies or vice versa. It's so tempting to do because doggies are so sweet, but that's not a great idea. So now I want to share with you some of my favorite sources for information since this whole thing began. And what I'm going to do right now is I'm just going to stop sharing this particular page, and I'm going to go to these sites right now to share with you what we've got. Let's see here. Okay, so this is an excellent site. Let me refresh. This is a site that was created by Johns Hopkins in the United States, a well-reputed hospital at Cancer Treatment Options and Management. We've shared patients with Johns Hopkins and have always found them really excellent to work with. And what they did when this whole thing began is they created this Coronavirus Resource Center, as you'll see on my screen here. If you look in the red, you'll see that as of today's date, Friday, the 27th of March, about 3 o'clock in the afternoon, Pacific Standard Time. We have 590,594 total confirmed cases of COVID. Of those, if we look on the far right, we see in green, total recovered 130,865. And right now, reported deaths from COVID around the world, 26,943, which I did the math before we started today, amounts to about 4%. 4% of total confirmed cases have died, which is about what we were told to expect when this whole thing began, anywhere from about 4 to 6%. So we're pretty much on cue. As you can see here, it's listed by country. So let's go to the US here. The US has surpassed everybody with cases right now, having over 100,000 cases. You can click there, and as you see, now the total deaths and total recovered is very specific to the US. You can scroll through and you can find your region and see what's going on there if you want to. You can also have a look, which I think is kind of reassuring, at places that first dealt with this, such as China, such as Italy, South Korea. Where are you, South Korea? These were the places where this outbreak really hit hard at first. And you can have a look at how different of these countries are now succeeding in keeping the numbers down, particularly China and South Korea. And South Korea is actually really a great success story, and for one very obvious reason that I think is just important for you to keep in mind, because I think it can instill a lot of hope for the future for us. And right now it can be hard to feel hopeful. South Korea has had really the best response of any country thus far in terms of keeping that curve that we talk about flat. You can see, well, actually it's looking like it's high there, but in contrast to other countries and based on their population, they're actually doing fairly well. The reason for that, which I think is really interesting, is that in 2005, South Korea experienced a SARS outbreak. It hit them hard. Lots of people were killed. It was not a pleasant time. But in response to that, South Korea got really smart, and they've built up a massive pandemic response. They had protocols put in place to help to ensure that if anything like that happened again, that they would be quick to respond. And something like that did actually happen again. They had a MERS outbreak in 2015. Pretty sure it's 2015. And they still realized at that point that they needed to do some tightening up. It started to get a bit away on them, but not as much as it would have because of the things they had done before. And so when this pandemic came around, they were ready. They'd already had 2 nationwide outbreaks. They had a wonderful response team set up. All of their testing, they had lots of tests, and their testing systems were really well established, great sterile technique, and so the spread of the disease was really mitigated as a result. And why I'm sharing that with you is because I think, you know, if we don't understand that it's possible for governments to learn from this, get ahead of it, and help to prevent it from having such a massive impact in the future, we can start to feel a little bit afraid about what the future is to bring, as more and more viruses that we don't have immediate vaccines for are shared around the world or originate. So I like to look at South Korea as an excellent example of what can happen when countries learn from past experience. So now I want to share with you the Canadian website. All these links are going to be in that PDF that you can have access to, so it'll be really easy for you to keep an eye on these for yourself. The Canadian website, this is where you'll see a listing of all sorts of information about COVID and hospitals and what it's all about. But mostly what I want you to see here, if you're interested, is the number of confirmed cases by province. A number of probable cases is listed here as well as the number of people who have died from COVID-19. So we can see Quebec is really experiencing a massive inundation in a way that they weren't just a week ago. BC and Ontario were leading everybody in cases, but the number of confirmed cases in Quebec has really shot up. This site is the World Health Organization site. Let's see here, and they almost every day they have 3 or 4 health experts coming on to talk about the science of COVID-19, and particularly what's being done for bulk testing and what's being done for immunization development. And they also talk about epicenters around the world, and just really important information from a resource that you can trust is providing you with good medical science. As you can see, they're answering general questions, they're giving you situation reports, travel advice. Of course, we all know don't travel is the best advice. They're talking about research and development, and there's even a Mythbusters section here to allow you to actually make sure that you're not getting caught up in false information, but you are following best practices as based on science. I wanted also to share with you something. There was, I don't know, when this whole thing started, there was some talk about how perhaps the use of ibuprofen would make people with COVID-19 more sick rather than be helpful. This link here, which again is in your PDF, really the short version is that's not true. There's no evidence whatsoever to suggest that ibuprofen worsens COVID-19 symptoms. So acetaminophen and ibuprofen are both effective pain relief sources for you to use when you have COVID-19. I want you to make sure that you share that with people as much as you possibly can, as well as by all means share all these links. But that one particular piece of information could be really beneficial for somebody, especially because everybody bought the Tylenol. You're going to find no problem getting Advil, but it's pretty hard to get the acetaminophen right now because everybody kind of went nuts with this basic misinformation. And so all the Tylenol was purchased and lots of ibuprofen left. So not to worry if you've got Advil or other forms of ibuprofen handy and you were thinking, oh drat, I don't have any Tylenol. You don't need it. This will do the trick for you. I also wanted to share with you a Facebook page that I found helpful if you're on Facebook. It's called Coronavirus COVID-19 Scientific Discussion Space. We have some fun on this site. There's a few fun memes that get posted, but the data that gets presented has some good support behind it. So it is, I think, a private, or it says public. You do have to, maybe you just have to click to join. I can't remember, it's been a while now. But I highly recommend that if you're on Facebook. Coronavirus COVID-19 Scientific Discussion Space. Now I'm just going to switch back to my PowerPoint here because I want to share something else with you here. Let me see. Hang on a second. That didn't quite work. Share screen. Let's go. Okay. Oh, hang on a second, folks. Just gonna go back here. Okay, hang on a second. Let's open this one up here for you. Okay, so we went through these reputable sources of information. We went through Johns Hopkins, we talked about the Government of Canada site, World Health Organization, we talked about ibuprofen, we talked about the Facebook group. Now I want to share with you about groceries, because of course we definitely want to know how to get the groceries. So getting the essentials without getting COVID-19. Dr. Jeffrey Van Wingen, maybe you've heard of him, maybe you haven't. He's from the United States, and for some time he's had a YouTube channel talking about a variety of different things. But with the COVID-19 pandemic, he's made a wonderful video about how to handle shopping and takeout to reduce your spread of COVID-19 using sterile technique like they would in the hospital. Here's the link for it. I'll actually take you to his YouTube site in just a minute. But I want to run through the basic guidelines. It's really valuable information for you. Generally, the understanding is, wherever possible, if you microwave your food just a little bit, it shows that microwaving can make a big difference to whether any COVID virus is actually in your food that you're about to ingest or on your plate. It's important to note, freezing does not have the same effect. In fact, other strains of coronavirus have been shown to live in your freezer for up to 2 years. 2 years. So if you're thinking, oh, I'm bringing my frozen stuff home from the grocery store and I'm just going to put it straight into the freezer, I won't touch it for a few days, that'll be fine. Actually, not so much, apparently. The virus can live in the freezer for up to 2 years. So we have other plans for that. But let's talk about shopping services and delivery services for starters. So I've mentioned FedEx coming to your home, maybe to bring one of our test kits or return it to us. Where also lots of folks are ordering shopping services or takeout. We'll talk more about takeout in a few minutes. Ideally, if you're going to use a shopping service, the fundamental do's and don'ts, don't have that person come into your home. Have them leave the things outside. Don't allow them to come into your home and perhaps bring the COVID virus with them, or perhaps get it from you. You might be one of those asymptomatic people. Have them leave the groceries on the porch or outside. Latest data says coronavirus can live aerosolized. So let's say I have coronavirus and I cough and it lands somewhere on my laptop. It can live right around there for about 3 hours. So anybody that were to come into my office and touch my laptop in that 3-hour period of time could very well contract COVID-19. Now, this is especially relevant for you if you're thinking about going to the grocery store. You might think, hey, I'm the only person in this aisle, it's all good. Well, we don't know who was in that aisle before and whether they happened accidentally to cough a little or sneeze a little while they were holding this thing that you're now about to put into your cart. Coronavirus can live on cardboard for 1 hour. So think pizza delivery. 1 hour can be on that cardboard. And it can live on metal and plastic for 3 days. So again, kind of think about things you're bringing into the home, like canned goods, or maybe a bag of trail mix and things like that. Coronavirus can live on those products for 3 days. So Dr. Jeffrey Wingen suggests that if possible, leave those groceries on the porch or in the garage for 3 days. That's not necessarily possible for everybody based on where you live or the type of grocery that you're bringing in. So don't worry about it. We've got a plan for that. But if possible, leave those things outside if you can for 3 days. While you're shopping, start out with some Lysol wipes or some good antiseptic spray. Wipe down the cart handles or anywhere that you're likely to touch the cart with those wipes. You want to assume that whoever was there before you had COVID-19, and maybe their kid was in the cart and they also had COVID-19 and they touched everything. Let's presume that. Don't worry about seeming like you're overreacting. It's really important to be seen like you're overreacting right now. It's the appropriate time to do that, and therefore not an overreaction. So wipe down those cart handles. Ideally also, Dr. Van Wingen says, commit to buying before you touch anything. In other words, you know how we might wander through the aisles on a normal day. We might pick something up, look at the ingredients, decide if that's what we want. This is not the time for that. This is the time to get in and out as quickly as you possibly can. Absolutely. Keep that distance, that llama distance between you and the other person. And before you pick anything up off the shelf, make sure it's on your list or something that you want. So kind of touch it once, put it in the cart, end of story. If you have any respiratory symptoms at all, for the sake of the people out there, don't go shopping. Have someone pick some stuff up for you. Really just avoid these public spaces. And ideally, no one over the age of 60 should be going out and doing these things right now. I understand that there's best practices and then there's reality for some of you. Some of you won't have someone who can do these things for you, in which case it's even more important that you follow these things we've talked about preparing to go, about how to handle being at the store, and what we're about to talk about what you do when you get your groceries home. As much as there's this talk of hoarders, and we don't want to be one of those, the rule of thumb is to try to get 2 weeks of groceries when you go. So you don't have to go again for 2 weeks. Plan what you buy ahead so you can really minimize your time in the store. Again, we're not going to be looking around and wandering around like you might on a normal shopping trip, at least like I might on a normal shopping trip, maybe not you. If you can, call ahead and have the things that you know you want prepared for you. Grocery stores are quite inundated right now, but if you're patient, you can probably get through and they'll do this for you. Everything's just going to take a little bit longer, and we need to accept that that's the reality right now. Pet stores and pharmacies will happily prepare an order for you. So those are 2 stops that you might have to make in addition to the grocery store that you can really make a lot shorter and minimize your exposure. Dr. Jeffrey Van Wingen talks about when you get your groceries home, you follow sterile technique protocol. And his video, he walks you right through it. Again, I'll take you to that site and show you the link. But I'm just going to walk through the steps that he talks about. Before you bring your groceries in and put them anywhere, so there you leave them in the car or maybe put them on the front porch depending on your circumstance, what you should be doing is clearing your countertop. I know not everybody has a lot of counter space, but clearing as much space as you can, and you separate your countertop into 2 sections. The section that the groceries that just came in from outside are going to go on, and the section that the cleaned, sanitized groceries are going to go on. In his video, he's got a piece of tape down the middle. I don't know that you need to do that, but it could hurt from, or could not hurt from a visual perspective. But I think he's just really wanting to accentuate that there's 2 separate sides and never the twain shall meet. So you split the counter into half, put new groceries on the one side, and that's the only space in the home they touch. So they stay outside until that space is ready to rock and roll. Then you bring them in, pop them down there. That's the only place those bags from the grocery store are going to be touching. What he then suggests you do is actively disinfect the outside of all packaging. You can use a spray depending on the type of packaging. Of course, cardboard you might not want to spray. Plastic, metal, of course you can. But you want to either use a wipe or you want to use some spray and disinfect the outside of the packaging. Let's say you've got a cereal box. You take the inside plastic packaging out of the cereal box and put that on your sterilized side, and the cereal box itself, which was exposed to other people at the store, goes directly into your garbage, which we'll talk about in a minute. Use alternative storage containers as much as you can. So when you bring a loaf of bread in, for example, rather than wiping off the outside of the loaf of bread, preferably dump all the bread into a Tupperware container or another bag or container, and then take the bag that you brought in from outside and put that in the garbage as well. He recommends that fruits and vegetables that can be washed, like apples and oranges, that you actually put them into fresh soapy water. and you let them soak for a few minutes, and then you wash each piece of fruit, just like those 20 seconds that you would do with your hands. You're going to do that with your fruits and veg too, just to make sure that there's no coronavirus on these things. Is in the same way, if you think about it, that the virus can live in your freezer for up to 2 years, your fridge is a less hostile environment. So don't be thinking that because it's in the fridge, it's dead. It's not like a little fly that you brought in from the vegetable garden. It's something far more dangerous. If you use cloth bags for your shopping, which of course we've all, well, probably most of us anyway, started to do, and it's a wonderful thing to do for the environment. But if you do, you should assume that they've somehow got some of the COVID-19 on them. You should put them outside for at least 3 days after you've used them, and then throw them in the washing machine. You know, we are trying to be so environmentally conscious as a species, I think. So it might feel really bad or wrong to use plastic bags, or perhaps your supermarket has actually already gone the way of not offering plastic bags. So cloth bags might be all you have to use. But again, if you're getting 2 weeks of groceries or about that, those bags can go outside or on your deck for 3 days without any consequence to you. And that way, if there is any COVID-19 on those bags, somehow it won't affect you. Now we'll talk about takeout. It's kind of the same thing as we just went through with bringing your groceries in. You want to make sure the delivery person does not come in. You don't want to be touching anything that they're touching and vice versa. You want to sanitize your countertop. You want to separate the counter space with the stuff that just came in from outside and maybe the plate or whatever it is you're going to be putting your food on. In other words, you're not going to eat from those takeout containers. If there's sauces like ketchup packs, you squeeze those onto the plate, and the packaging of those packs go back into the takeout containers to be put into the garbage and immediately disposed of outside. Once you're done bringing the takeout in and putting it onto the plate, you're going to wash your hands really well again with lots of soap for at least 20 seconds. And then you'll know you've done everything you can to prevent bringing COVID-19 into your home. And you can just relax and enjoy your meal. You won't have that little hamster on the wheel in the back of your head wondering if perhaps that you're getting COVID right now. So follow those best practices, and that'll help. Let's actually just go right now and look at Dr. Van Wingen's YouTube video.
I'm a family physician practicing in Grand Rapids, Michigan with 20 years experience. The point of this video is to help you shop safer and get takeout food safer during the stay-at-home shutdown due to the coronavirus pandemic.
Okay, so we're not going to watch the whole thing, but that's Dr. Jeffrey Van Wingen. I highly encourage you to visit that link and just watch that video. He walks you through the whole process. It's very handy. The other thing that I wanted to share with you is that there is a video here. Let me just see here. Oh, here we go again. Hang on a sec. Okay, so you folks, if you've watched this far, are probably the choir I'm preaching to here, and this is just a little more information to help you feel even more validated about taking these precautions. What I want you to see in this Mythbusters episode is really how easily viruses spread. Even when you're trying to be careful, even when you know there's something to be concerned about and you're following all these practices, it's really important to understand how easy it is still for viruses to affect you. Mythbusters made a video. It's about 5 minutes or so long, and it's they simulated one of their cast members having a virus, and then they simulated this person having drinks and a visit with some friends. They were playing a game of dice. Everybody touched the dice, things like that. For 30 minutes, they sat together. And a few of the people in this video knew that they were trying to steer clear of a virus, and so they were trying to be really careful. Others didn't know at all. And then at the end, they tested to see, did the people who knew what was going on manage to avoid it altogether? What about these people over here? I won't ruin it for you because I do want you to watch it. It's really powerful, and it really will help you to appreciate what you're dealing with here. I'll just show you the link so that it's familiar to you when you go. It's called Mythbusters Contamination. It's already had over 1 million views, as it should. It's been around for a little while, I guess. It wasn't specific to COVID, but of course, people are very interested in this right now. So on YouTube, Mythbusters germ spreading is what I Googled, and came up with the video I was looking for. It's just under 6 minutes long, well worth the watch, I guarantee you. And now I'm going to go here. And let's see here. What else do I want to share with you? Oh, well, that's it. That takes us to the end of our time together today, I guess. So let's see here. We talked about a whole bunch of things today. Let me just stop my little share here. Oh, okay. So you know what's happening with your cancer treatment. You know the precision oncology is still going on. COVID-19 treatment is available. You know about social distancing. You know about best practices for grocery shopping or visiting the pharmacy or the pet store as needed. That grocery store technique is very helpful because we all need to go there. Another thing that we didn't talk about, but is important to note, is going to the gas station, because of course at some point most of us will need to fill up with gas. Best practices: wear a disposable glove or have a wipe in your hand as you're using the gas pump, as you're typing in the information for your credit card, and then give your hands a good spray or a good wipe down before you get back in the car. And always, of course, as soon as you come in, you want to give your hands a good wash, even if you've just done everything I just said, just to be safe. You do not want to wish you had followed these best practices. You want to know you did and try to avoid this until we can get an immunization and we can avoid getting COVID or passing it to the people we care about. Okay, I think that's it for now. I'll be back within the next week or so with an update if there's anything more significant to share with you. You've got some links to some excellent sites: Johns Hopkins, Canadian government, World Health Organizations. Remember, ibuprofen is okay. There's no legitimate data that shows that it is not as effective or that it could make things worse. None at all. That's just an urban legend. Who knows where that came from? So go ahead, if Advil is your drug of choice for pain or for certain symptoms, or if you were taking it for chronic illness and inflammation, it's something that medical science says you can continue to do. So I hope that you found this beneficial. I welcome your comments and questions because I will be making more videos as this whole thing progresses, and I'd be happy to make videos that are specific to the questions that you have most. So I hope you take care out there. I hope you're finding fun things to do on your own or with friends or family. Remember, you can hop online in so many different ways: video conference, play games with each other. You can even watch TV shows with each other from afar. So while you can't have those hugs from the people who you're not self-isolating with, you can get pretty close to having a lot of quality time with them. So take good care, and we'll talk again soon.
Thank you for watching Ketome TV. Subscribe below and stay informed.